Okay, welcome to session 2. We're going to try this as an experiment. I'm going to record this audio for a few minutes, and then we will talk about it at the beginning of our session on Tuesday. Okay, last week we started to go over the model of social connection that had the two figures, and in particular we spent some time talking about emotional expression and providing safety, and we did some exercises. And so the important point for this week is that we really want to use that full model, and I'll go over the rest of the model over the course of the next few weeks, as the basis of our treatment in two ways. First, we want the model to identify treatment targets, and in particular, we're talking about when our clients are presenting with problems related to loneliness, fear of intimacy, insecure or avoidant attachment, or other things in that domain, any things that have to do with these kinds of problems that the model fits really well. So we'll use the model to identify treatment targets for these clients. And then number two, the model also guides the therapist precisely in what to do in session. So this is the model that I presented last time, and we'll be going over it nice and slowly over the next several weeks. Just as a reminder, we start with awareness, and for intimate interactions to go well, we want a full, mindful, accepting, balanced awareness of yourself, what you're feeling, what's going on in your body, what you need, and awareness of the other person, what they're feeling, what's going on in their body, what they need. And with awareness, we are now in a better position to engage in the courage and love behaviors that are central to the model. And we talked about three sub-relations between courage and love. The first one is emotional expression. When you're expressing your emotions, you want the other person to provide safety. The second one is self-disclosure. When you're disclosing how you feel or what's going on in your life, positive or negative events, who you are, you want the other person to provide validation. And then the third one is asking. When you're asking for something specific, you want the other person to give you what you've asked for. And then down there at the bottom is this idea of connecting, that when somebody has responded to you with love, with responsiveness, your task now is to receive that response, accept that response, and we call that connecting, and let the other person know how you feel. And that's a vulnerable thing to do itself, which is why the arrow goes back to these other courage behaviors. All of this sits on a foundation of balance and reciprocity. We want both people engaging in all of this reciprocally in a balanced fashion over time for intimacy to develop. So this idea of using this model as a set of clinical targets in FAP can be approached a few different ways. First, you can really use any of these targets as targets in FAP. But what I'm going to mostly do in our work together is focus on what I consider to be the set of classic FAP targets to make the task easier. And these classic FAP targets are here, essentially on the courage side of the dynamic. The first target is self-awareness. We're going to help our clients be more aware of what they're feeling and what they need. And then with that awareness, engage in more courageous behavior, more emotional expression, more self-disclosure, more asking for what you need. And then getting better at connecting and accepting people's responses after they've engaged in the courageous behavior. So these are the classic FAP targets that we'll be spending a lot of time with in our work together. And then the second idea that we can use this model to guide how the therapist responds to the client is essentially this. In FAP, we want to encourage our client to engage in these target behaviors, and when they engage in the target behavior, we want to provide the response that's indicated by the model, because that's the natural thing that's supposed to happen in intimacy. So we want to encourage our client to engage in self-awareness and emotional expression, and when they do that, we want to respond by providing safety. Likewise, we want to encourage our clients to engage in vulnerable emotional self-disclosure, and when they do that, we want to respond with validation. And this, of course, is essentially what happens in almost all psychotherapies, right? But what we're doing in FAP is we're making this process really explicit. We're teaching you how to do it really well, And we're using this process as the basis for helping the client with their intimate relationships and growth in these particular areas. Likewise, we want to encourage our client to ask us, the therapist, for what they need. We want them to be aware of their feelings and their needs, and we want to help them get better at asking us, their therapist, for what they need. And when they do so, we want to try to give them what they need. Now, this gets tricky as a therapist, and we'll talk about how it gets tricky and how to handle it ethically and so forth as we go through. But just want to orient now to the fact that we can do this in therapy, and when we're doing it, we're essentially modeling what we want to happen in good, healthy, intimate relationships. And finally, we want to work on the connecting target. And this is a little tricky, but I think you'll be able to get it. We want to help our clients, encourage our clients to engage in more connecting behavior in response to our behavior as therapists. When we provide safety, when we're validating, when we give the clients what they need, when we express appreciation to a client or talk about the client's positives or strengths, we want the client to be able to accept all of those responses and not push them away, and to let us know, in turn, how they feel in ways that move the relationship forward. This is what we call connecting. We'll talk about it in other weeks, but for now I just want to point out that this is something we want to work on with our clients. And when our clients do this, because it's a vulnerable thing to do, it cycles back through the model, and our job, again, is to provide safety to the clients when they do this, to let them know that nothing bad will happen. So that's what I mean by we can use this model to determine the treatment targets in FAP, and we can use the model to guide our behavior in responding to the clients, encouraging the clients to engage in these targets and responding to them when they do. The final piece of the FAP puzzle is after we've had these interactions with our clients, after they've engaged in these behaviors in session with us and we've responded, then we talk with our clients about what occurred and we encourage them to do it with others in their life. And that essentially is FAP in a nutshell. To summarize, the key to FAP and what distinguishes FAP from other approaches is that we're not just talking about the client's life and we're not just talking about these behaviors in the client's life, but we are actively, intentionally encouraging our clients to engage in these behaviors during the session with us in the moment. And the key is that we are responding to the client in the moment, and that response is the most important part of FAP. And then after we respond, we help the client do more of this with others in their life.